I'm Dr. Ben, and today we're doing stretching for sciatica. Whoa. Hold the phone. What's the problem? For months now, you've been telling people not to do stretches, but to do glides for sciatica. What gives? Are you trying to bait and switch me? It's no trick, because when you know the right time to stretch, when to glide, and the why, that's when real progress happens. Are you serious? Check this out. We're going to make real change today. Let's go. Oh, my back is tight. You better stretch. Yeah. Hold on. Let's back up for a moment and make sense of this. Your nerves are always firing to help send messages from brain to the rest of the body through the canal space of our spine, and they can get irritated or compressed along the way. Disc injuries can compress the space and the nerve in the spine, and as the nerves exit out the glutes and piriformis muscles, it can get entrapped there as well, especially from inactivity and sitting jobs. Nerves aren't as flexible as people realize. They're not like rubber bands, they're more like rope. Imagine a tunnel space and you're trying to move and that tunnel space gets smaller, possibly from a compressed disc, arthritis, stenosis, and now you're trying to stretch and pull, and it's just going to irritate and tether that nerve even more. You have to find gentle ways to reduce the pressure, and that's where nerve glides came about. Your muscles are more flexible, like a rubber band. And when you're doing daily activities that might cause tension and stress in the muscle, that will also irritate and sometimes compartmentalize the nerve. So you can't ignore that either. So we're going to go through 5 important principles on how to stretch the right way. And when you have a minute, check out our videos on sitting with sciatica and standing with sciatica. We actually show you the anatomy of those positions and how it applies stress on both disc and piriformis issues and how to avoid them. Principle number 1, go with the path of least resistance. If your sciatica is really bad, it's better to start with a nerve glide. If I'm lying on my back getting out of bed, I'm going to bend my knee and gently raise my leg a little bit and proceed with extending and flexing the head. This takes pressure off of the nerve and opens up space in the canal without overwhelming the muscle. You can perform these seated or standing and do 10 each before beginning a stretch. That way you're a little bit more primed in the spinal canal. Principle number 2, start with a smaller range of motion and slowly expand, testing the water of your limitations. You don't have to do a big stretch, but some of my favorite ones often get overlooked. I can take a stretching strap, or at home even a towel. Make sure you're in a comfortable position to start with. And I'm gonna do a hamstring stretch. Usually we poo-poo the hamstring stretch when it comes to the spine because too much of a pull can aggravate the piriformis. But if I lie back gently and start with a small range of motion and a bent knee on my other side, I can feel a stretch and hold for 20 to 30 seconds. If that's too much, bring it back down. But if you can handle it, we try a little higher, get a deeper stretch, making it comfortable with your back flat, holding for 20 to 30 seconds, and down. Another one of my favorite stretches for the piriformis is the figure 4. I bring my leg up very gently, and if I can't raise it this high, I can still bring my knee a little lower to open up the space and perform the exercise without it being too intense. And if that's easy, then I can go underneath and grab to get a bigger stretch. Try a few glute, piriformis, and hamstring stretches on your own and see what is comfortable and see what's not. This can also be a diagnostic, and if you check out our other videos with piriformis versus disc, it'll help you better understand, pinpoint what's best for you. Principle 3, if it hurts, keep it bendy. Remember, nerves don't stretch very well, so if I'm trying to do a hamstring stretch or glide, if I lift too hard with my legs straight, it really tethers the cord. Instead, I can bend the opposite knee when I stretch the affected side, and I can even bend that knee of the affected side to get it up a little higher without it irritating the nerve. The goal is to feel the stretch without pinching and tethering. So you find what's right for you at the level that's right for you, and hold generally 20 to 30 seconds at a time. Generally, when you're stretching, you want to be warmed up, not cold. Unless you're in severe pain, and if that's the case, check out our acute guides, because ice is really important when the pain is that severe. Otherwise, I'm going to take a heating pad and I'm going to lay it down where I'm going to stretch if I'm seated or on the floor if I'm lying down. And after the hips are warmed up, I can gently raise my leg for a figure 4. Performing it this way can be more comfortable and more effective on loosening the muscle. And last but not least, Principle 5 is so important because engaging your core before you get up from that transition from stretching to daily life can really make or break a spasm. When you're stretching, it's good for your body, but it also relaxes muscle tension around the spine. Then you need to engage your inner core to wake it up, so to speak. That way those muscles are firing the best way possible to protect your back during transitions. Whether your sciatica is disc-driven or piriformis-driven, these principles are going to keep you moving safely. And if you'd like real complete routines built from these rules, check out our playlist for complete guides for morning, nighttime, and your full day. No speeches, no sermons, just real facts and real change. Let's go.